So ankle sprains are very common. The usual reasons are either uneven surface, wet surface, being in the dark, missing a step, very often even at home, and also sports activities, jumping, landing on someone else's foot on a different object that makes the ankle sprain go around. And it's normally in 90 some percent, it's the outside. We can injure the inside, which seems to be a more significant injury, but normally it's very common that we injure the ligaments on the outside. So there are different ligaments on the outside, on the inside, and we have the high ankle injury, which is a lot more severe, but fortunately a lot less common. So the most common ligament injury in the world is the ligament injury on the outside of the ankle joint. And there it's normally a ligament called ATFL. Most people might have heard about it. That's the first ligament that ruptures, but there are more ligaments. And the more ligaments are injured, the more significant is the injury. And there are different types. So ligaments hold the bones together so the joint is stable. And ligaments can, like tendons, come a little bit apart, but completely apart, can be completely torn. And there might be one, two, or three ligaments on the outside. But they don't always have to rupture completely. A mild sprain is completely different to one where all the components are ruptured and the ends are completely apart. But sports injuries and uneven surface are the common reason for that. But it's important that people understand what has happened and what needs to be done. Well, it's interesting. Most patients do understand the severity fairly soon. Often patients come in and they say, I've sprained my ankle a couple of times before. This time it was different. I hoped it would be the same, but no, I can tell. I heard a popping sensation. That might be a typical explanation for a more severe injury. It swelled up straight away. I couldn't weight bear. It discolored. I've played football. I had to stop. I tried to continue. I couldn't. That is clearly a sign of a significant injury to the lateral ligaments. But other times it might be that they just go over. They have to wait a bit, and then gradually they can resume. They might even be able to go back to their sports, walk home, and then it's important that they understand what has happened and what can be done about it. But yes, it's not always easy for the patient. There's some who think, well, stiff upper lip, and we have to continue being active, walk a lot, do a lot of things. That is potentially good for a very mild sprain, but not for a proper ankle injury. But patients most of the times do understand that. Well, the treatment, of course, depends on the severity of the injury. So if it's a very mild sprain, they're gone over, they could continue walking. We don't have to worry too much about it. Generally, most people know rise, so that means rest, elevation, ice, a bit of compression does help. But when they're a bit more affected, they have some swelling, they are very much aware of the pain, not only when walking, they need to rest probably more. People think we have to be active, we have to mobilize our ankle. That might be okay for the mild sprain, but if there's more significant injury, we have to rest. But not only resting in ice and probably taking some anti-inflammatory medication, but we need to avoid certain movements. So one thing I have seen recently a couple of times, that patient put some warm around it, because when you injure yourself, it should be warm. Well, that's for the chronic conditions where we have chronic ongoing problems with a joint, with tendons. The warm weather might help, but in an acute setting, it needs to be cold. The second one is the patient should not bend their foot down too much. That ligament I mentioned before, ATFL, could get stretched out when patients bend their foot downwards. The main movement is upwards. Upwards is the movement that we tend to lose generally, more likely than downwards, and we need it a lot more. So we need to focus on getting the ankle up, but not down. When we bend the foot down more than 20, 25 degrees, then there is a lot of stress on that ligament that might heal, but it will be too long. It will not hold the ankle properly anymore. So it's important that they try not to get full range of movement downwards, but only upwards. They ideally benefit, especially if it's not only a grade 1, a mild sprain, but a grade 2, a proper ligament injury, more than one ligament involved. They should have some ankle support. A tuber grip can help a little bit, but normally a soft ankle brace, not a firm one. On an acute injured ankle, a firm one with plastic or metal support is not one isn't able to wear. It's very uncomfortable. So a soft ankle brace with Velcro strap around will give the ankle joint the support. We can adjust it. It doesn't hurt. And even though a soft brace can't give you probably the support that you would need when you re-injure it, but by putting pressure on the skin, it activates nerve endings and they support what we call the proprioception. That means the body reacts better and it learns quicker to regain full function. So it's absolutely helpful to get some soft ankle brace around the ankle when walking, when becoming more active in particular. This does not make you weaker. A boot, a plaster would make you weaker, would reduce the muscle activity. A soft ankle brace doesn't reduce the muscle activity, it gives support. So I often recommend from the beginning to have some support, rest it, and avoid the bending downwards too much. But if symptoms do not improve, well, then we have to look what else can be done. Well, it's an interesting thing to look up Google. Recently, a patient came and said, well, I've been looking up my injury and it says it can take a week, a mild sprain, but then you look at other websites and it says it can take 6 to 8 weeks. So the recovery, of course, depends on the severity of the injury and what the patient was able to do afterwards. If you have a patient who went running in the woods and has to walk home and had a proper ligament injury, the recovery will take, of course, a lot longer than if they sprained the ankle at home, could rest it, ice it, and didn't do too much afterwards. So it depends on what injury it was, how many ligaments are involved, and also is there an injury inside the ankle joint? Did, when they go over on the ankle, share of a bit of cartilage? Did they pull some other structures around the ankle joint, which will heal but will delay the recovery? So therefore, we recommend coming to see a specialist relatively soon to inform the patient what needs to be done, how long the recovery will be, and what can be done to speed up the recovery. So in order to give proper advice, for me, it's good to get the history, gives us a lot of information, and to examine the ankle. The instability or stability of the ankle joint initially doesn't help too much when tested because if there's a lot of swelling, one has the impression the joint is stable, but it isn't. It's the swelling that gives the false impression of stability. But from taking the history and then listening to the patient properly, we get an idea how much is injured. We can, of course, then get further testing done. An X-ray normally not needed. It's just if we think there is a bony injury, we can get an ultrasound scan done by a dedicated radiologist. We can get an MRI scan done, especially to rule out other pathologies. Is there anything in the ankle joint? Would the patient benefit from having some fluid drained, injected something? That all depends on the severity, on the recovery. So if patients cannot weight bear, I think they should come and see a specialist. I'm happy to give all the advice to investigate what needs to be done without doing too much. And then advise whom they should see. Should they see a physiotherapist? Most of the times, yes. What activities can they do? Focus on the exercise. And it's not enough to see the physiotherapist. It's important to do the exercise themselves at home. Avoiding the stress to the ligaments. As I said, bending down, it needs to be avoided. And then, depending on how the patient is recovering, seeing a podiatrist, seeing a radiologist to have further investigation. And then only a few patients need surgery. So normally patients do not need surgery when they sprain their ankle, even a bad ankle sprain. Professional sports people get an operation straight away because they need to fully recover, and the club normally doesn't care too much if there's any complication. They need to play as soon as possible. Normal ankle sprains do not need surgery unless there are certain conditions, and I'm happy to discuss those with the patient then. But normally a good recovery can take 6 weeks with some support. A full recovery might take 3 months. That depends on the severity. But yes, first 2 weeks, we need to take it easy. If after 6 weeks, patients aren't really getting better, we can get further investigations arranged. And patients for a severe ankle injury need to know it might take 3 months to fully recover. But normally we get the patients back to their level of activities. They can resume their sports activities or any other activity, providing they follow the guidelines and they don't do anything that puts them at risk of re-injuring, because that's the main risk initially, not only that the ligaments don't heal properly, but we miss something else which delays the recovery, or that they've done too much and the ligaments have healed but in elongated position, so it doesn't provide the support that the patient does need. Well, the first thing is to be aware of the problem they're having. There are two different types of instabilities. There's one where the ligaments are torn, that didn't heal well, and they're mechanically unstable. So they need to work with a physio, they need a brace, and these are the patients where potentially they would benefit from surgery if they re-injure their ankle all the time. So this is a small group, but normally if the patients are aware of the problem, they can learn exercise that they need to do at home. And we've seen Andy Murray, other players, especially American basketball players, they wear ankle braces. They get some support on, which makes it less likely that they re-injure themselves. But to work on the balance, on the proprioception, on the stability, wobbleboard exercise, being guided by the physio is the main thing to achieve. Well, if we do surgery, we can provide good stability to the ankle joint. We tighten the ligaments. We put something on top that's called an internal brace, which speeds up the recovery. But patients normally don't need that in the vast majority of cases. So patients need to be aware of what problem is, and they need to know what activities they can do to achieve a stable ankle. Those patients who have not injured the ligaments, and we see that they have good stability of the joint. It's not lax, but they don't know how to stabilize. When there's a bit of uneven surface, they fall over. That's what we mentioned, the proprioception. That's the main thing. That's fairly easy to learn, but they need to do those exercise. And they certainly never need surgery because there's nothing injured inside. They need to train their muscles to react quickly. Not strong muscles, but muscles that react to uneven surface, to wet surface when they go over, that they know how to react and they will not fall over. They will not therefore injure the ligaments or the ankle joint. So that's absolutely crucial to know. Is it a mechanical instability or what we would call a biomechanical? They go over, but the body doesn't react appropriately without having any ligament structure or anything else damaged. And then there are patients who have a joint problem inside the ankle joint. There might be a cartilage defect. There might be some inflammation that gives them, again, the impression of an instability. They get the pain and therefore they go over. And they need to be certainly investigated to find out what is the reason they go over despite the ligaments being intact.